In this video, I'm going to talk about substance abuse disorders, and I'm going to talk about stimulants and hallucinogens. So stimulants are agonists for dopamine, so they increase that level of dopamine in our system, giving us a feeling of euphoria. They also increase noradrenaline as well and give us energy as well. So some examples of stimulants are cocaine, methamphetamine, Ritalin and dexedrine, which are attention deficit medications, and I'm going to talk a little bit about why do we give a stimulant medication to a little kid that has attention deficit, and how does that work. There are also some synthetic stimulants out there, methamphetamine being one of them. There also are some drugs that are coming over from China that have different chemical compounds but act as stimulants. So we'll talk a little bit about bath salts and flocka, and this is MDMA, which is Molly or ecstasy. And then also you might not think about caffeine and nicotine as drugs, but they are definitely stimulant drugs. And they all create psychological dependence. So they're based on psychological or emotional needs, but not based on physical dependence. So all the stimulants and the hallucinogens as well create more psychological dependence. You want the drug, but you don't necessarily physically need the drug like you do with a depressant. There's no physical withdrawal symptoms. They get out of your system within a couple of days, but you do feel pretty horrible once that drug starts to wear off of your system. You might have symptoms of severe depression when that drug effect wears off. These are some examples of psychological withdrawal symptoms, and these might look really familiar to you: irritability, headaches, insomnia. If you've ever tried to cut back on your caffeine intake or stop smoking, you definitely may have had some of these symptoms, and hopefully they only lasted a week or so and you felt better after that. Depending on the strength of the drug, you might feel worse longer, for sure. So cocaine is a very expensive drug, and it definitely also is a stimulant. It increases the level of dopamine and noradrenaline, and it gives you this euphoric feeling. It's made from this coca leaf plant, these little berries here. It's a dopamine agonist, and it creates 10 times the normal level of dopamine. So if you had a great day at work or school, you'd get some dopamine in your system. If you use cocaine, you get 10 times that level. So it creates extreme psychological dependence, but not physical dependence. And it can cause problems with anxiety. It interrupts your sleep cycle, and definitely people become severely depressed when they stop it. And the effects only last 1 to 4 hours, which is not very long. It's the most potent natural drug. It's highly addictive. Crack is a form of cocaine. It's a synthetic form of cocaine that can actually be smoked, and that allows the effects to quickly reach the brain. And I forgot to mention here that the coca leaf, when it was discovered, they thought it was a miracle cure as well. They thought it was a great treatment for depression until they realized once it wears off, you don't feel so great. And they also did put trace amounts of cocaine in Coca-Cola, and that's where Coca-Cola actually got its name. They thought it was a miracle thing. It was kind of an herbal thing, so they put it in everything pretty much. And Coca-Cola is named after that. And they've substituted caffeine for that nowadays. We don't have cocaine in our Coca-Cola anymore, but early on it did actually have some cocaine in it. So some other synthetic stimulants that we haven't talked about yet are methamphetamines. We talked briefly about bath salts. These are synthetic stimulants that were packaged to look like they were bath salts. They were also a little bit chemically different than methamphetamine, and so they were able to get past customs and be sold as legal things. In 2012, it was discovered, and they did pass a law to make this particular stimulant illegal. But it's a big problem with drugs coming over from China. They're hiding them in different types of packaging, and their chemical compounds are slightly different than the actual drug, and so they're getting passed, but they have the similar or same effects, but often very, very dangerous. So ecstasy or Molly is a synthetic stimulant. It's also a hallucinogen too. It was originally created as an antidepressant medication, and it actually does increase that serotonin level, which we know is involved in mood. It increases dopamine and norepinephrine, gives you that same euphoric feeling. There are some definite negative side effects of ecstasy and Molly, which we'll talk about when we talk about hallucinogens. But we're still on stimulants. So methamphetamines can really have some really detrimental effects on people. So chronic use can lead to paranoia, psychotic symptoms, anxiety, mood disturbances, and violent behavior. Many heinous crimes have been committed while somebody was high or overdosed on methamphetamine. And when I say psychosis, a lot of times people that are using methamphetamine will see things or hear things or feel things that are not there. You see these young, cute women here, and then you look at their faces after using methamphetamine for a while. They have all these sores on their face, and it looks like they have severe acne. But what it is they're hallucinating that there's bugs under their skin, and they're picking at their skin to get rid of the bugs. And that's due to the methamphetamine abuse. And you see them all over their arms and legs and other parts of their body as well, people that use methamphetamine. Also, you see a lot of weight loss because they're not eating, because they're not hungry from the stimulant. You also see severe dental problems, rotting teeth. This is a mild picture of meth mouth. This guy had beautiful teeth, and now they're just rotting. And what happens is the body takes the calcium from the teeth for nutrition because they're not getting any nutrition. So it definitely causes a lot of physical problems as well as psychological problems too. There have been many campaigns to try to discourage meth use, and it seems to be working. Meth use has dropped, but it's still very cheap and very available, and that's one of the problems. This is one of the pictures that they showed to try to discourage people from using methamphetamine. And I think this is over a 14-year period, but you know, a young, sweet, innocent girl, beautiful, and over 14 years, just look at what the drugs have done to her. Can you overdose on a stimulant? Yes, you definitely can. And it can cause you to be really violent and aggressive. A lot of times when you see police officers having to arrest somebody who's high on methamphetamine, they can have kind of superhuman strength. They're out of their mind, they're aggressive, and they're violent and really dangerous. So you can overdose on that, and you can also die from an overdose on a stimulant. It can cause you to have seizures, a heart attack, coma, and even death. So it's a really scary thing. So you do need to be really careful about that. So Flocka is something that was around a few years ago. It's no longer around. It was similar to these bath salts that I talked about before. It's a synthetic stimulant that's trying to mimic the effects of cocaine and meth, but it has a different chemical compound, so it was getting through. And it hit Florida. And this is a Florida State student that actually murdered a couple in Florida. The couple was just sitting out on their front driveway enjoying the evening, and he and I don't know if his fraternity brothers or college friends had a party, took this Flocka, and he went crazy. And he murdered this poor couple that was just sitting in their driveway. And when the cops came to arrest him, he was eating the man's face. So really some bizarre behaviors on these drugs. And whenever you get an overdose or a huge dose of stimulants, you can get some pretty scary, bizarre behaviors. So definitely something to think about. So that's Flocka. I had a video that showed a guy running and jumping through the back window of an SUV, shattering that window when he was high on Flocka. So it's just amazing and scary to think of what people can and will do on really strong stimulant medications. So now I'm going to talk about Ritalin, Adderall, and Dexedrine, which are actually medications that are used to treat attention deficit disorder in children and in adults. So we used to think kids grew out of attention deficit, but that's not necessarily true. So many adults still need medication for attention deficit disorder as well. But it's often abused by parents and often sold as a street drug as well. And the reason why it works for attention deficit is it increases the neurotransmitter activity in the frontal lobes that are involved in impulse control, focus, and judgment. And that's why it's helpful in treating attention deficit disorder. Kids and adults who have attention deficit disorder do not have the high effect that you would get from a stimulant. They just have improved focus and impulse control. So the last group of drugs I'm going to talk about are hallucinogens. So these are drugs that can produce hallucination, and they can be auditory, visual, or kinesthetic. They distort your sensory perceptions. They alter your mood and distort your thinking. So some of the ones we're going to talk about are LSD and marijuana and Molly. We're not going to probably talk too much about mescaline guess I can move myself up here. This is peyote here, and I guess I don't know what term you'd call that. Mescaline is the term they use in the book, but peyote is something we would be familiar with from the Native American community here in Arizona. And it comes from a flower in a cactus. And it acts similarly to marijuana as a hallucinogen. And then I don't think we're going to talk about PCP or Special K, but those are also hallucinogens as well. So hallucinogens create distorted perceptions of reality. They skew the perception of the passage of time. You can have visual hallucinations, distorted body perception, so you might feel like you're superhuman, like you're a giant. Hallucinogens themselves do appear to have less addictive properties than other drugs, but many of these drugs we haven't been able to study in psychology because they are illegal. And that's been one of the big problems, because we would really like to understand what are the long-term effects of using marijuana, what are the long-term effects of different hallucinogens, and we don't know that answer right now. So we talked a little bit about MDMA before. It actually decreases activity of the amygdala and reduces your sense of fear. It's a combination of an amphetamine and a hallucinogen. And people can get into trouble when they use Molly because they forget to drink water. They can get super dehydrated. It also raises your body temperature. But a lot of times people are so out of it when they've taken this drug, they don't pay attention to being thirsty or being overheated. And people can actually die from this. So you do need to be careful about that. And there have been people that have died because of not drinking enough water and not taking care of themselves. But there is a community, even a psychological community, that is actually exploring the use for treating post-traumatic stress and depression of some of the other hallucinogens, not just Molly and ecstasy, but just, seeing if they could be therapeutic as well. There's something called the Zendo Project, which is kind of interesting. It actually helps people that might have a bad trip when they're at a concert or a festival because they've taken LSD or a psychedelic drug of any kind. And they actually have tents set up there and, helps people get through that. And what happens is, if you get too much of a hallucinogen in your system, there's nothing you can do except for wait it out until you feel better. So they have tents with, beds and stuff where people can kind of relax and they can comfort them and help them get through that trip. So it's interesting. Oh, and this is just a cute picture of a kitty and what it might actually look like if you were hallucinating. Your perceptions are distorted. You're seeing things in rainbow colors that really aren't there. You're seeing things that are not generally there. So marijuana is a mild hallucinogen. So a lot of people are surprised that it's actually a hallucinogen because they don't think about it as that, but it is a mild hallucinogen. The active component in marijuana is THC, and it remains in the system for months. That's why if you used marijuana a couple months ago at a party and you're applying for a job, you could test positive for marijuana. Now you're no longer high from marijuana, but that THC is still in your system. Spice is synthetic marijuana that is now illegal, but it was fairly common for a while. And it was a super high dose of marijuana. It was causing people to be really zombied out and non-functioning, basically. But it was because it was such a high dose of marijuana. Marijuana, it's not going to surprise anybody, is the most commonly used illegal drug. It can cause paranoia. And it's a little bit unusual in that it raises your heart rate like a stimulant, but it slows movement like a depressant. It does cause changes in the reward center of the brain, so it increases that level of dopamine. And there's a lot of debate about the long-term use of marijuana. And there's definitely concerns about adolescents using marijuana frequently because there's a huge amount of brain growth that's happening during that time frame. It also interferes with your sexual function, your memory, your motivation. So there are definitely some definite drawbacks to marijuana. And there is a correlation between marijuana use and schizophrenia. Other professors have said that using marijuana can cause schizophrenia. I don't believe that. I think we'd have a much higher rate of schizophrenia if that were the case. But there is a correlation, and it may be that schizophrenics schizophrenia sufferers actually use marijuana to calm some of their symptoms. That's a possibility. So there is a correlation. Do you guys think you can overdose on marijuana? You actually can. It won't kill you, but it can cause you to feel pretty horrible. So you can have really increased paranoia, extreme anxiety, your increased heart rate, feel sick to your stomach. They call it a green out. It usually occurs more when you eat it rather than when you smoke it. And that's one of the things, there's a lot of edibles out there right now. And it's more difficult to kind of control how much you're getting into your system when you eat it. And of course, it has to be processed through your stomach and through your blood system when you're eating it. So you may eat more without realizing its effect until it's too late. And it definitely, there is an increased impairment and danger when you mix marijuana with alcohol. And if you do overdose, the effects can last for days where you feel pretty miserable. Nobody's ever died from a marijuana dose, but you definitely want to be cautious when you are using marijuana to not overdose on it, especially if you're eating an edible. You want to take it slowly. So combining marijuana and alcohol can be dangerous because alcohol actually increases the absorption of THC and intensifies its effect. So it's not completely safe. It's something I wanted to warn you a little bit about. And marijuana also seems to decrease that effect of alcohol initially. So you think you're not drunk and then it hits you much more rapidly later. So you don't realize how intoxicated you are until it's too late. So there is an increased risk of alcohol poisoning, and marijuana also inhibits vomiting. That's why it's good for chemo treatment and HIV patients and others. But you may need to throw up the alcohol that you drink. So you definitely want to be cautious about that. So that is it